Pathology of cardiovascular system. Atherosclerosis. Atherosclerosis affects the small, medium, and large-sized arteries and associated or caused by hyperlipidemia, diabetes mellitus, hypertension, and smoking. It is characterized by formation of focal atheroma or fibrofatty nodule. Atherosclerosis characterized by the presence of clinical and pathological manifestations due to narrowing of the lumen of blood vessel and ulceration of the atheroma. There are three main stages in the development of atherosclerosis. Early stage, that is called non-progressive stage. Late phase, that is called progressive stage, and complicated stage in the form of ischemia, aneurysm, and ulceration of plaque or atheroma. Early stage or non-progressive stage of atherosclerosis characterized by formation of fatty streaks within the intima and composed of lipid deposition with lipid-laden macrophages called foamy cells. This gross picture of early stage of atherosclerosis, showing linear, slightly visible, yellow in color lipid deposition and red in color lipid deposition stained with Sudan stain. Histological picture of non-progressive stage of atherosclerosis, showing aggregation of foamy cells with vacuolated cytoplasm. Late stage or progressive stage of atherosclerosis is characterized by elastin and collagen deposition, smooth muscle cell proliferation within the fatty streaks, leading to the formation of fibrofatty nodule. This fibrofatty nodule consists of two main parts, superficial part and deep part. Superficial part is called fibrous cap and is composed of elastin, collagen, fibroblastic cells and smooth muscle cells, and foamy cells. Deep part, that is called necrotic core, composed of necrotic debris, calcium, lipid deposition with foamy cells, and cholesterol cliffs, and also calcium. Here we can see subintimal lipid deposition that is yellow in color, and reduction of lumen, showing blood content. Histological picture of atherosclerosis. Here we can see narrowing of the lumen, intimal plaque or nodule that is composed of lipid deposition, foamy salts, and cholesterol cliffs. And also we can see calcifications that are blue in color. Here we can see lipid macrophages that are called foamy salts with vacuolated and clear cytoplasm. Cholesterol cliffs in the form of needles associated with foci of blue calcification. Complicated stage of atherosclerosis. There are many complications of atherosclerosis: ischemia, deep stem artery, aneurysm formation, and ulceration of the fibrofatty nodule. Ulceration of the fibrofatty nodule results in intraplaque hemorrhage, thrombi formation, and formation of cholesterol emboli. Here we can see ulceration of the fibrofatty nodule. Here in your left side you can see fibrofatty nodule above the surface of blood vessel wall, and in your right side you can see rupture or ulcerated nodule showing hemorrhage. Here you can see reduction in the blood vessel lumen filled with blood, and you can see fibrofatty nodule showing more needle shaped of cholesterol cliffs. Clinical significance of atherosclerosis is due to involvement of arteries supplying blood to brain, heart, kidneys, lower extremities, and small bowel. It may lead to ischemic heart disease, cerebral infarction, gangrene of lower legs, and aneurysm. Systemic hypertension is defined as increase of systemic arterial blood pressure above the normal level. There are two main types of systemic hypertension: primary and secondary. Primary type is the most common type and the cause is unknown. There are many risk factors including stress age, obesity, and decreased physical activity. Secondary type is caused by known diseases like renal and endocrine diseases. According to the clinical course, both types, primary and secondary, of hypertension may be benign or malignant hypertension. Benign hypertension, characterized by slowly rise in blood pressure and affects old age. Pathological changes of benign hypertension including change in the blood vessels in the form of hyaline arteriolosclerosis, kidney change called hypertensive benign nephrosclerosis, characterized by hyaline arteriolosclerosis of the small arteries and arterioles, leading to small kidneys with granular surface and thick adherent capsule. Histologically characterized by atrophic change of tubules and glomeruli. Heart change called benign hypertensive heart and characterized by left ventricular hypertrophy with thick wall of the left ventricle more than 15 millimeters. Changes in eye characterized by mild hemorrhage. In brain called hypertensive encephalopathy and characterized by mild cerebral hemorrhage. Picture of hyaline arteriolosclerosis showing thickened wall blood vessels with pink eosinophilic glassy material, leading to the narrowing of blood vessel lumen. In this picture we can see thickened and hyperplastic left ventricular wall. In this picture you can see large hypertrophic myocardial fibers with enlargement of nuclei that are dark in color. Small kidneys with granular surface. In this picture we can see arteriole with thickened wall showing glassy hyaline eosinophilic material. In this picture we can see cerebral hemorrhage. Malignant hypertension is commonly caused young persons and characterized by rapidly rise in blood pressure, characterized by pathological changes involving blood vessels in the form of hyperplastic arteriolosclerosis and necrotizing arteriolitis, kidney that is called hypertensive malignant nephrosclerosis, characterized by involvement of glomerular capillaries by necrotic changes and inflammatory changes, leading to their rupture and formation of multiple foci of hemorrhage on the kidney surface called flea-bitten kidney. In heart, it is called malignant hypertensive heart, characterized by slight enlargement of the heart with formation of foci of ischemic myocardial infarction. In eye, characterized by severe retinal hemorrhage and papilloedema, that means edema of the optic disc. In the brain, characterized by severe cerebral hemorrhage. Here we can see hyperplastic change of the subintimal fibroblastic cells and smooth muscle cells of the media, leading to the narrowing of lumen. The appearance is called onion skin. Here we can see involvement of glomerular capillaries by necrotizing arteriolitis, leading to the rupture and hemorrhage. Ischemic heart disease is defined as group of closely related syndrome resulting from an imbalance between the cardiac need for oxygenated blood and its supply. There are four main types of ischemic heart disease: angina pectoris, myocardial infarction, chronic ischemic heart disease, and sudden cardiac death. There are three main causes of ischemic heart disease: increased myocardial demand for oxygenated blood, reduced oxygenated blood, and reduced coronary perfusion. The last cause, reduced coronary perfusion, is the most common and important cause of ischemic heart disease. Reduced coronary perfusion is due to coronary atherosclerosis and its complications, including formation of thrombosis, embolism, and reduction of lumen. Angina pectoris is caused by short myocardial ischemia that doesn't cause necrosis. Angina pectoris characterized by fibrotic and atrophic change without necrosis, characterized by severe and short chest pain, relieved at rest or use of nitroglycerin. There are three main types of angina pectoris: stable, transmetal, and unstable. Stable angina pectoris is the most common type and caused by coronary artery atherosclerosis. Pain occurs by physical exercise or emotional stress and relieved by rest or nitroglycerin. Transmetal type or variant, uncommon, caused by sudden vasospasm of coronary atherosclerosis. Pain occurs with no physical activity and can occur at rest, relieved by nitroglycerin. Unstable type, common and caused by complicated plaque of atherosclerosis, including thrombosis embolism. Pain occurs with slight exercise, and this type of angina pectoris can progress to develop myocardial infarction, relieved by prolonged duration of therapy with vasodilators. Myocardial infarction is caused by severe and acute myocardial ischemia, leading to formation of myocardial necrosis, characterized by severe, sudden and prolonged chest pain, not relieved by nitroglycerin. According to the degree of thickness of ventricular wall involved by ischemic necrosis, there are two main types of myocardial infarction: transmural infarct and subendocardial infarct. Transmural infarct is the most common type and characterized by involvement of full thickness of the left ventricular wall by ischemic necrosis from the endocardium to the epicardium. Is caused by atherosclerosis of one coronary artery with severe stenosis. Subendocardial infarct, uncommon and characterized by involvement of only 1/3 to half of inner thickness of the left ventricle by ischemic necrosis, caused by multifocal atherosclerosis of all three coronary arteries, but without critical stenosis of the lumen. According to the type of coronary artery involved by atherosclerosis, there are three main anatomic regions of myocardial infarction: atherosclerosis of left anterior descending coronary artery results in infarction of anterior left ventricular wall and anterior to third part of interventricular septum. Atherosclerosis of right coronary artery results in infarction of posterior wall of left ventricle and posterior 1/3 part of interventricular septum. Atherosclerosis of circumflex left coronary artery results in infarction of lateral wall of left ventricle. Here we can see myocardial infarction involving the anterior wall of left ventricle in the form of yellowish necrotic area surrounded by congested zone of granulation tissue and blood. Diagnosis of myocardial infarction is made up by elevation of cardiac markers, mainly troponin I, that is specific for myocardium. In this picture, you can see irregular area of whitish necrotic tissue. Histological picture of myocardial infarction. In this picture, you can see two main zones: infarcted or necrotic zone without nuclei or with rise of nuclei, and congested zone infiltrated by acute inflammatory cells. Complications of myocardial infarction: erythema, left heart failure, rupture of the infarcted heart, fibrinous pericarditis, cardiac aneurysm, cardiogenic shock, pleural thrombus, and recurrence of infarction. In this picture, there is rupture of capillary heart muscle involved by infarction. Chronic ischemic heart disease or myocardial fibrosis is a clinical syndrome of ischemic heart disease that occurs in patients with previous angina pectoris or attacks of myocardial infarction, characterized by myocardial fibrosis, which may be focal or diffuse, clinically characterized by gradually development of congestive heart failure. Grossly, the heart is hypertrophic with enlarged size and reveals foci of white fibrosis, and histologically characterized by the presence of interstitial myocardial fibrosis that is pale in color with the hypertrophic change and large staining nuclei. In this picture, you can see foci of myocardial fibrotic tissue, pale in color. Sudden cardiac death is a complication and often the first clinical manifestation of ischemic heart disease. It is defined as sudden death within 24 hours of the onset of cardiac symptoms and caused by coronary atherosclerosis with severe stenosis, rupture of atheroma with thrombosis and embolism, leading to fetal erythema.